Every morning, before the world asks anything of you, your body is already sending you a message. And for millions of people over the age of 60, that message arrives the moment they open their eyes. A mouth so dry it feels like the moisture was quietly erased overnight. A tongue that clings to the roof of the mouth, nothing to swallow. A reaching for the water glass before a single word has been spoken. If that is how your mornings begin, I want you to know something important right now. That is not aging. That is not trivial. And that is absolutely not something you should keep ignoring. I'm Dr. William Lee, and I've spent my career focused on the health of older adults, understanding the ways the body communicates when something is quietly going wrong. What I want to share with you today is something I genuinely wish more doctors took the time to explain, because the truth about dry mouth is far deeper, far more connected to your overall health, and far more treatable than most people ever get to hear. So I want you to take a breath, settle in, and give this your full attention, because what you learn here could genuinely protect your life. If this kind of honest, research grounded health information is what you've been looking for, go ahead and give this video a like right now. It tells me you want more of this, and it helps make sure other people who need this information can find it too. Let's start with something most people never stop to think about: saliva. We treat it like it's just background noise, something that's simply there when we eat. But saliva is one of the most biochemically remarkable fluids your body produces. It contains over 700 proteins, enzymes, and antimicrobial compounds. It is quite literally your mouth's immune system. It neutralizes bacteria before they can travel anywhere dangerous. It starts the digestion of carbohydrates the moment food enters your mouth. It coats and protects the delicate lining of your throat and esophagus. And while you sleep, it quietly controls the bacterial environment in your mouth so that the microorganisms naturally present there stay in balance. When saliva disappears or drops significantly, none of that happens. The immune checkpoint goes offline. The bacteria that were being kept in careful balance begin to surge, and the downstream consequences to your lungs, your heart, your digestion, your brain begin to accumulate slowly, quietly, in ways that often don't become visible until someone is already in serious trouble. A 2021 study from the University of California, San Francisco, following over 12,000 older adults, found that those with confirmed dry mouth were nearly 3 times more likely to be hospitalized for a respiratory infection within 24 months. Nearly 3 times. And yet, most people dismiss the symptom before their first cup of coffee. I want to tell you about a woman named Margaret. Her story is the reason I feel so strongly about making this clear. Margaret was 71 years old, a retired school teacher, the kind of woman who had spent 34 years putting everyone else first and never wanting to be a burden. When she started waking up every single morning with the mouth so dry, she kept a glass of water on her nightstand just to be able to speak. She said nothing. She assumed it was aging. She assumed it was normal. For 18 months, she woke up exactly like that every day. And during those 18 months, her body was communicating in the only language it had left. She lost weight without trying. A pound here, 2 pounds there, until her daughter noticed her clothes were fitting differently. She began struggling to swallow dry foods. She developed a chest infection in the spring, another in the fall, another the following winter. Each time she received antibiotics and was sent home, and each time not a single person asked the question that most needed, asking, why does this woman keep getting chest infections? The answer was happening every night while she slept, because her mouth was dry. Bacteria that saliva would normally neutralize were being microscopic ally inhaled into her lungs during sleep. This is called microaspiration, and it happens to all of us. But in a healthy mouth, saliva handles it. In Margaret's mouth, there was nothing to handle it. For 18 months, bacteria were quietly making their way into her lungs every single night, until one Tuesday morning, she woke up unable to breathe, her oxygen saturation down to 81%. Healthy adults sit at 95% or above. And the diagnosis from her pulmonologist was aspiration pneumonia, severe, developing not over days, but over many months, 19 days in the ICU, a permanent lung damage. And here's the part that I find most heartbreaking. When Margaret's daughter went through her mother's medical records, she found that Margaret had been on 5 medications for 6 years, and not one physician had ever reviewed how they interacted with each other. 3 of those medications, a blood pressure pill, an antihistamine, and a bladder control drug, all belong to a category called anticholinergics. These are among the most potent suppressors of saliva production in modern pharmacology. Margaret's dry mouth was not a side effect to be tolerated. It was her body sounding an alarm for half a decade, and no one listened. This is not a rare story. This pattern affects roughly 30% of adults between 65 and 75, and nearly 40% of those over 75. And it almost always comes down to 5 things that most doctors never fully explain. I want to walk you through all 5 because understanding these is what gives you the power to protect yourself and the people you love. Stay with me here because the next part is where most people finally start to connect the dots. The first thing to understand is that medication combinations are far more dangerous than anyone tells you. Over 500 medications list dry mouth as a side effect, including blood pressure pills, antidepressants, antihistamines, diuretics, bladder medications, and sleep aids. When someone is taking 3 or more of these at the same time, research published in the Journal of the American Dental Association in 2023 found that the suppression effect does not simply add up, it multiplies. 3 exergenic medications may not cause 3 times the dryness. They may cause 6, 7, or 8 times the salivary gland suppression. This is called compounding exergenic effect, and almost no one discusses it during a prescription review. If you are currently on 3 or more medications, this matters directly to you. The second thing is that dry mouth causes malnutrition even when you are eating regularly. And this surprises nearly every patient. I explain it to saliva does not just moisten food, it contains amylase, an enzyme that begins breaking down carbohydrates in your mouth, and it sends chemical signals to your stomach to prepare for digestion. Without adequate saliva, that signal goes quiet. Nutrients pass through without being properly absorbed. A 2022 study from the Mayo Clinic found that 44% of seniors diagnosed with unexplained malnutrition had clinically significant dry mouth that had never been identified as a contributing factor. You can eat 3 balanced meals a day and still be slowly losing what your body needs. That is a sobering truth, and it matters enormously. The third thing is that a dry mouth is an open door for bacteria to reach your heart, your brain, and your bloodstream. Your mouth naturally hosts around 700 species of bacteria in a carefully balanced ecosystem maintained by saliva. When saliva disappears, the dangerous species begin to surge. And according to research published in Nature Reviews Microbiology in 2023, they do not stay in the mouth. They enter the bloodstream through tiny breaks in the gum tissue and have been directly linked to heart valve infections, worsening blood sugar in diabetics, accelerated cognitive decline, and sepsis in vulnerable older adults. I want to share one more story before I give you the 7 warning signals, because this one carries a very specific message for anyone currently on multiple medications. Robert was 68 years old, a retired firefighter from Atlanta, 31 years of walking into burning buildings. When dry mouth woke him every morning, he did what he had always done with discomfort. He pushed through it. 2 years passed, then the tooth pain started. When his dentist examined him, she paused before speaking. 8 teeth destroyed by aggressive decay in 14 months, numbers she had only seen in patients who had undergone radiation therapy. She began asking questions and discovered that Robert's acid reflux medication, combined with his blood pressure diuretic, had been chemically stripping his mouth of protective moisture for 2 full years. But the teeth were not the worst of it. When she ran a bacterial culture, the results made her reach immediately for the phone. Robert's oral bacterial levels were among the highest she had seen outside of a hospital setting. A 2023 study from Johns Hopkins, following over 8,000 men between the ages of 65 and 75, found that elevated levels of this particular oral bacterium were associated with a 34% increased risk of a major cardiac event within 18 months. Robert's cardiologist found early arterial inflammation. His medications were adjusted and his dry mouth was treated. Robert is healthy today, but he was roughly 6 months away from a potential cardiac event. And the only reason he is still here is because his dentist thought to ask about dry mouth. Now I want to give you the 7 warning signals. These are specific patterns that dry mouth can be part of, and each one points toward something that deserves medical attention. Pay close attention here because this is where most doctors do not connect the dots during a standard appointment. Signal 1 is dry mouth, accompanied by a metallic or chemical odor in your breath in the morning rather than the usual stale smell. This pattern can indicate kidney function changes, and it warrants a kidney function panel. Signal 2 is saliva that feels thick, ropey, or foamy rather than simply absent. This is not a dehydration sign. This is an altered saliva pattern that can signal autoimmune activity, including conditions like Sjgren's syndrome, lupus, or rheumatoid arthritis. Ask your doctor about autoimmune screening. Signal 3 is dry mouth that is primarily or exclusively a nighttime and morning problem, while daytime feels relatively normal. This is a direct pattern associated with sleep apnea. When the airway partially collapses during sleep, the body compensates by breathing through the mouth for hours at a time, evaporating every trace of moisture. A sleep study is worth requesting. Signal 4 is dry mouth, paired with frequent urination during the night. This combination is a meaningful warning signal for diabetes. Elevated blood sugar pulls water from every tissue in the body, including the salivary glands, while simultaneously driving increased urinary output. Request a fasting glucose test and an HbA1c as soon as you can. Signal 5 is dry mouth, accompanied by dry, gritty, or uncomfortable eyes. This pairing is the hallmark presentation of Sjgren's syndrome, an autoimmune condition estimated to affect 1 in 70 women over 60 and significantly underdiagnosed in older adults. It is absolutely treatable, but if it is missed, it can progress to affect the kidneys, the lungs, and the nervous system over time. Signal 6 is dry mouth, combined with leg or foot cramps, particularly at night. This combination points toward a serious electrolyte imbalance, specifically low sodium, potassium, or magnesium. If you are on a diuretic, this combination is especially important to address promptly, as an electrolyte crisis combined with dry mouth can contribute to cardiac arrhythmia. Contact your doctor this week, not at your next scheduled appointment. Signal 7 is dry mouth that began within 90 days of starting a new medication. This is your body telling you that it needs a polypharmacy review. The 90-day window is when anticholinergic suppression tends to reach its clinical threshold, meaning the full effect on your salivary glands becomes measurable. Do not wait. Now, I want to give you something practical, not a passive list of problems, but a real clear set of steps you can begin with right now, because knowledge without action does not protect anyone. I want to pause here and ask you something. How many medications are you currently taking? Go ahead and leave that number in the comments below. You may be surprised to see how many people watching right now are in exactly the same position and have never had a formal medication review. That single comment could open up a conversation that changes things for someone else. Step 1 is to begin a simple morning mouth assessment. Before you drink or eat anything, take 60 seconds. Is saliva present when you wake up? Does it feel thin and watery or thick and difficult to move? Is there any unusual chemical or metallic odor? Can you swallow comfortably without needing water first? Doing this daily and noting what you observe gives your doctor real useful data to work with rather than a vague complaint. Step 2 is a medication audit. Write down every single medication you take, prescription and over the counter, and check each one for the words anticholinergic or xerogenic. Then, when you speak to your doctor, use this exact language. I would like to request a formal polypharmacy review focused on my combined anticholinergic burden. So, those specific words signal that you understand what you are asking for, and they tend to move the conversation in a very different direction. Step three addresses something people often get wrong. Water alone does not fix dry mouth. Your salivary glands need electrolytes, specifically sodium, potassium, and bicarbonate, in order to produce saliva. Plain water in large amounts can actually further dilute those electrolytes. Small, consistent sips throughout the day, paired with electrolyte rich foods, is far more effective than a large glass of water at bedtime. Step four is a nighttime protection plan. Elevate the head of your bed by 4 to 6 inches using bed risers rather than stacking extra pillows, which can strain the neck. Run a cool mist humidifier set to between 40 and 60% humidity in your bedroom. And just before sleep, use a xylitol-based dry mouth rinse, never one containing alcohol, as alcohol will worsen dryness. Step five is saliva stimulation during the day. Xylitol gum after meals is clinically supported and easy to implement. Sour, sugar-free candy activates the parotid glands, which are your major saliva-producing glands. Including crunchy raw vegetables with your meals naturally encourages saliva production through chewing. These are free, simple, and genuinely effective tools. Step six is your doctor conversation guide. Use this language directly. I have been experiencing chronic xerostomia that is affecting my sleep quality, my ability to eat comfortably, and my swallowing. I would like to discuss whether my current medications are contributing to this, and I would like to request a salivary gland function assessment. Clinical language produces clinical engagement. You deserve that level of response. Step seven is your emergency red flag list, and I want you to hold on to this. Dry mouth paired with difficulty breathing means go to the emergency room immediately. White patches inside your mouth mean call your doctor today, as this can indicate oral candidiasis. Dry mouth combined with sudden confusion or weakness means call emergency services now. Dry mouth paired with chest pain or a rapid heartbeat means call emergency services now. And dry mouth accompanied by an unexplained fever means same day urgent care, not a wait and see approach. If you find the kind of content I share here genuinely useful, I'd love for you to subscribe so you never miss a video. My goal is always to bring you research that is real, stories that are honest, and steps that are actually actionable. That is what you deserve from a health resource, and that is what I am committed to giving you. I also want to answer the two questions I know are sitting in the back of your mind. The first is, my doctor told me this is just part of aging. Is that true? No, clinically significant. Xerostomia is almost always the result of a medication, a medical condition, or the interaction between both. The phrase "it is just aging" is a dismissal, not a diagnosis. You have every right to push past it, and now you have the vocabulary to do exactly that. The second is, can drinking more water fix this? No. Dry mouth is a glandular function problem, not a hydration problem. You cannot water your way out of a gland that is being suppressed by a medication or an autoimmune process. These are two different issues, and treating them as the same is one of the most common and consequential mistakes in senior health management. I also want to be clear about one more thing. If you wear dentures, dry mouth is still dangerous, and in some ways even more so. Bacteria colonize rapidly beneath denture bases against gum tissue when saliva is not present to regulate them. You do not need natural teeth for dry mouth to create serious systemic consequences. The same risks apply. Let me bring Margaret's story to its proper ending, because it does not finish in the ICU. After 19 days, she came home, weaker than she had ever been in her life. But she came home, and her daughter Linda came with her with a documented record of every missed symptom, every overlooked medication interaction, every dismissed concern. Two of Margaret's medications were adjusted. One was stopped entirely. Within 6 weeks, Margaret's dry mouth was almost completely resolved. Within 3 months, she had regained 7 of the 11 pounds she had lost. Margaret now volunteers 2 afternoons a week at a local senior center. She and Linda created a laminated card printed in large, clear text, the 7 signals. Over 200 of them have been given away for free. And every time someone takes one, Margaret says the same thing. I thought it was nothing. It almost killed me. Please don't make the same mistake I did. That is the spirit in which I make every video I put out. You deserve the truth about your health, delivered calmly, clearly, and completely. You deserve a conversation with your doctor that feels like a real exchange, not a clock running down. And you deserve to go to sleep at night knowing that you have taken the steps available to you. So here's where I want to leave you. Start with the morning mouth assessment tomorrow. Build the medication list this week. Use the exact language I gave you at your next appointment. Implement the nighttime protection steps tonight if you can. And if any of the 7 signals resonate with you, do not wait. Your body has been communicating. Now you know how to listen back. You are not powerless here. You are informed. And that is exactly where everything good begins.